The conversation back home, Gauteng Health MEC Dr. Bandile Masuku and Health Minister Zweli Mkhize are due to visit the Mukhari Academic Hospital today. The healthcare system in the province is currently in the spotlight because of the ongoing surge of COVID-19 cases in the country's economic hub. Now, the province recently broke the 100,000 mark of infections. Our very own Sipha Kema is just outside the Mukhari Hospital and joins us now live ahead of that oversight visit. Sipha, of course, there are a lot of questions to be asked about operations at that facility, including some real concerns around security. Give us an idea of what the Health Minister and the Health MEC are going to be looking out for.
Well, Ayanda, as you mentioned, that the MEC and the Minister are expected, of course, to visit Mukhari. Now, this visit is part of the support visits and state, and also to evaluate the state of readiness at the COVID-19 designated hospitals as well as quarantine sites. I mean, we know that last week, Friday, the Minister and the MEC visited Tshwane District Hospital just to evaluate, as you said, of course, because of the sudden surge in the numbers of COVID-19. Now, Gauteng, of course, when we started out in South Africa with the COVID-19 pandemic, they were the epicenter, and then they were surpassed by the Western Cape. But now they're back being the epicenter of the pandemic in the country, and as you've said, Ayanda, they have reached the 100,000 mark. Of course, now this is a major concern, Ayanda, as it's been said that, of course, the health system in the province is now feeling the pressure, actually, and not just with the numbers coming in, but, I mean, you do have other patients that are coming in and admitted into hospitals. And of course, during the time when it said that during the time when liquor was allowed and not banned, that casualty and trauma unit were filled with accidents. Hence, of course, the ban of liquor will assist them. Now, Ayanda, looking at these contributing factors, as I said, shortages of beds, of course, a shortage of medical equipment as well as medical staff. The health system in the province is feeling the pressure. And also, Ayanda, the Minister, Zweli Mkhize, had also said that his concern was the sudden quick surge where Gauteng was looking at 200 daily cases, and it quickly rose to 3,000 to 400 cases a day. And also that, in the beginning, the confirmed cases of COVID-19 weren't active. But now it seems as though the majority of these cases are active cases. So those are patients that should be admitted into intensive units. And also, Ayanda, there's also an issue of course, South Africans who cannot self-isolate and self-quarantine at home due to, of course, living in households that are densified, and some of them, of course, living in in government-subsidized houses, which makes it hard for them to self-isolate and quarantine. Hence, they've been booked in, even though they have mild cases. Now, of course, it's not, of course, all bad and gloomy, Ayanda. The minister yesterday, he did say that, of course, they're looking at different hospitals here in Gauteng where they will add in an additional 200 beds and, of course, 2,000 field hospitals to assist with the numbers that are coming in for COVID-19. So it seems as though they're trying to look at a plan, and a part of these visits is to actually evaluate the beds that are here and what else needs to be done and how many beds need to be in each hospital to accommodate the growing numbers of COVID-19.